Hi, my name is Dr. Antolak at thegentlendentist.com in Shelby Township, Michigan. Phone number is 586-247-3500 in case you're interested in any dental treatment that you want. At our office we provide a full line of services for our patients, so that's basically one-stop shopping. Today Marshall has agreed that we can go ahead and record this and put it on YouTube. Say hi, Marshall. Oh. Marshall is gassed up right now, and I just numbed Marshall up, so he's good and ready to go. And what we're going to do is we're going to extract some of his wisdom teeth. And if we look here on this x-ray that we took, we can see that these are the wisdom teeth. The third molars are the wisdom teeth. These 4 teeth here we're going to take out today. We got them nice and numbed up. The thing that we're always concerned about with wisdom teeth is that right in here is a nerve that gives sensation to the lip and the teeth, and it comes like this, it comes around like this, okay? And the roots of the teeth, for Marshall, it's a good time to do it because the roots aren't completely formed here. Sometimes if they get really too long, like for example in this one here, it can encroach upon where the nerve is and affect the lips, having numbness in the lips and the teeth. So this is the right side, this is the left side. Once again, this is where the nerve will traverses down here, and we're going to remove this. These are called soft tissue impacted because they are actually encased currently within inside the bone of inside the soft tissue. It's kind of sitting in there. So basically we have to make an incision and basically like a banana peel. We have to peel the banana back so we can gain access to where the tooth is. So if this, you can stop this video now if any bloody things bother you. If not, then right now Marshall is completely numbed up, and basically I want to just point out to where the teeth are going to be removed over the top here. And so these are his first molar, second molar, and the third molar is like in this position right here. Okay. So actually right in here I can feel his tooth right there. His tooth is just poking through the tissue. So we're going to make an incision here, reflect it back, and remove it. And it's the same, that's his left side, and also his right side is the same thing right back in here. So first thing we're going to do is we're going to numb him up. You're completely numb? Your lip feels real fat, Marshall? Mm-hmm. Yes? Okay. So I use what's called a bite block. That's going to help to open real big for me. What that's going to do is help to stabilize his lower jaw. And 15 blade. Okay, Marshall, open up wide, please. And so we're going to create an incision here. And Marshall, you just raise your hand if you need me to stop, okay, bud? Okay, so right now we're just going to create a little incision here so we gain access to it. And so I'll need a polyester elevator. Okay. And so now, Marshall, you're just going to feel some pressure, okay? And you're not feeling anything, correct? Okay, good. You're just going to feel lots of pressure now, okay? And so now I'm just going to go ahead and you get to see this on YouTube. Just think, isn't that fun? So actually, when we do actually remove, we put videos on YouTube, it's one of the most popular ones out there, because I know there's lots of you out there who have an interest in, you probably have a wisdom tooth that might be bugging you or something. Okay, can you suction them? Okay. So we're just basically going to open this up here a little bit. I'm going to turn my light on here. Actually, it's right over here. There we go. Okay, so right there. Some pressure. Marshall, just feeling me move around a little bit, and that's about it. Okay. Okay. Right there. So right now we went ahead and reflected the tissue back here. His tooth is sitting right in here. I'm just going to remove some of the tissue that covers it, and his tooth is right there, right underneath that area. And so I'm just removing a little of the bone around the tooth itself, and so that I can basically gain access to it, and then go ahead and just remove that. Okay, Marshall? Good, thumbs up. Alright, you gotta make sure you're comfy here. Okay, we're just gonna create a little bit more of a window there for that. Okay, so, go ahead and suction it there. Okay, so a lot of pressure now, Marshall. You okay? Alright, a lot of pressure, okay? And so right now we're just moving this tooth a little bit. Now it's just sitting right underneath there. Okay. And here it goes, lots of pressure. There it is. It's like birthing a baby. There it is. So I'm just putting a stitch in here. It's just like basically doing some sewing here. So of course Marshall's nice and numb, so he's good. So the idea when we put a stitch in like this is if we can approximate that soft tissue that was together there, then, okay, go and cut that. If we can approximate the tissues, they'll go ahead and heal nicely together. That's good. One more. And so then we're just going to take that back here, a little further back. And so he's got, can we retract this too? So we put about 4 stitches in this each area here. So yeah, we find more and more that it's better to actually take these wisdom teeth out at a younger age, especially because when it encroaches upon where the nerve is, then you have an issue, especially if there's not going to be enough room in the mouth. And it starts poking through the gums. Now there are some times when, okay, go ahead. There are some times when we can do the, wait and see if there's enough room in the mouth for them to erupt. Sometimes it's in those cases, if there's enough room in the mouth for them to erupt, then we can use them. There's another question: why do some people get wisdom teeth and some people they may not erupt all the way? Well, it's through our microevolution where we just don't have the need anymore for to eat these coarse diets that at one time we did, and so now we find that it's so some people just don't have them now. When I go to, it's interesting because when I go to Haiti, almost every person there, okay, go ahead and cut that. Every person there in Haiti, almost all have their wisdom teeth because their jawbone is actually bigger. Because here in America, we are a blend of many different cultures, that's good, and different ethnicity groups, is that sometimes we get jaws that are bigger, some are smaller, and so a combination of those two factors, it really affects it affects how much space and room there actually is available. Now when you see these stitches being done, it might seem like going high, but we have to actually keep that incision towards the cheek side because there's a nerve that runs through, and if we get too close to that, then we could it affects the nerve to the tongue, and we want to make certain that it obviously we do it as risk-free as possible. Now, go ahead. So we're going to be done with this side here. So he's done with his lower wisdom tooth on his right side. We're going to go ahead to the left side. There we go. There it is. Okay. So you can see that one was pretty